Hello, my name is Mackenzie, and this is my Phase 3 reflection on the entire assessment. In this e-portfolio, I learned so much about the importance of utilizing assessment skills, understanding social determinants of health, and how stakeholders are essential to providing well-rounded care. As nurses, we assess our patients constantly, but I feel like we don't consider the patient's social determinants of health enough. I'm an inpatient oncology nurse, and we do assess this in our initial admission paperwork, but it kind of gets dropped afterwards unless you are a case manager that's following up with discharge planning. I feel like as nurses, we should be more involved in that. We will assess for things such as if they have proper housing, but we don't really ask about income. We don't see if they have adequate transportation until they leave. So really assessing if they're gonna follow up with appointments doesn't get assessed for. And I really feel like that is important, especially with our oncology patients, making sure that they are following up with all of their treatment plan appointments and follow-ups with the specialists. I think it would be different if I worked in an outpatient setting, but no matter where we work, it is crucial to screen and advocate for our patients for their social determinants of health, especially when they are critically ill. This really is as simple as just asking if they have housing, do you have steady income, do you have constant access to food and running water? Because surprisingly, a lot of people don't. And they don't ask for help. It's sometimes embarrassing. So making sure that they understand that they can always come to us with such problems is important. For the patient scenario that I chose, I did the patient who had a myocardial infarction. I'm slightly familiar with these. I do have a medical step down component to the floor I work on. But we do not have any STEMI patients. We usually just get an NSTEMI or somebody with just demand ischemia. So we don't assess as thoroughly and don't do as much follow-ups afterwards. It's usually just from sepsis or some sort of strain. The patient scenario that I did, he had said he had exercised, but he had a very poor diet. He ate out a lot. He also had a history of hypertension, hyperlipidemia. I think it's far too often misunderstood that patients will be diagnosed with high cholesterol, high blood pressure. They put them on a magical Lipitor pill, and then that's the end of it. They don't get educated on the importance of diet and exercise and adhering to the treatment plan. And then when they come back in a year for their blood work, their cholesterol is still out of whack. So I really think that we dropped the ball on that, and that needs to be changed. Because although it does help having medications on board, there are things that the patient can do to modify all that. So I think that taking more time to educate our patients and our family as stakeholders, and then also making sure that we are being very transparent with any kind of caregiver or primary care provider on the recommendations from the specialist or the inpatient team is crucial so that they don't come back and have constant readmissions. Thank you.